Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with our weekly podcast. Today we're going to talk a little bit about brain fog and a couple things that you can do for it. We're going to be seeing the fallout of COVID for many months and probably years from all the neurological damage that it's caused, as well as emotional and stress and all this, and disrupting sleep patterns and all this. You know, as functional medicine doctors, we're really inflammatologists, if that's a word, but we look at inflammation. And when you talk about brain fog, you're talking about inflammation. Just like when you're talking about IBS or gut dysfunction, you're really talking about inflammation, fibromyalgia, inflammation. Really, any acute or chronic disease has its basis in inflammation. So we're inflammatologists as functional medicine doctors. Same thing goes with brain fog. So we're going to be seeing a lot of the fallout from COVID, not only with increased neurologic disorders, but with just a lot of general fatigue and cognitive problems and just what we call brain fog, which we've treated for years. I probably see that more in women with hormonal problems than I do in men. But so we'll focus a little bit on a couple supplements that I think may help you with brain fog. But again, I won't overemphasize the things that you need to think about when you have brain fog. And everybody I know that when I ask them if they have brain fog that really has it, says yes, they know what that is. So it's hard to describe, but it's just when your cognition is bad, your memory gets bad. You can't put thoughts together. You're not as sharp mentally as you used to be. In treating patients for years for ADHD, for narcolepsy, for shift worker syndrome, for jet lag, chronic fatigue. We're talking about brain fog, really. So the important things over anything, over any supplement or anything you can do, are just the four tenets that I base my whole practice on at Performance Medicine. The first of all, which is nutrition. And that's where a lot of what I'm going to talk about today comes into play with a couple of supplements that really help your nutrition. They're nutrient supplements. So nutrition, exercise, the best thing you can do for your body overall, for your health, I still think is exercise, whether it comes to treating depression or fatigue or even losing weight. Although exercise itself is not a real weight loss tool, nutrition comes first. So nutrition, exercise, then sleep. If you're not sleeping, you're not going to be healthy. And one of the supplements I'm going to talk about today is really, really good for sleep. Half our battle at Performance Medicine is getting people to look at their sleep patterns. And that's why I wear an Oura Ring every day. And along with sleep is stress reduction. As you know, stress can cause anything from cancer to heart disease to brain fog. The other thing, of course, is hormonal balance. And, of course, when we get to menopause, andropause, it gets a lot worse. So you really have to look at your hormones. And really, when I talk about hormones, a lot of times I include neurotransmitters, which are the chemicals in your brain that kind of help make up those connections, those synaptic connections in your brain that lead to your ability to think. So we're going to focus on some helping your neurotransmitters today, which I think will help brain fog quite a bit. I've treated a lot of adult ADHD in my practice, and really it's one of the most gratifying things that I treat because, there's a couple things that patients come hug your neck for when you've treated them well. And one of them, of course, is ADD. The other one is hormones. I get a lot of gratitude from patients when you treat both those things, especially ADD. I had a 60-year-old patient not long ago that I treated for hormones for years, and she happened to read that I treated adult ADHD, and she thought that she had it all her life, which in fact she had when I gave her the quiz and I talked to her a little bit about it. So I treated her and saw her back in a month, and she came in singing the song "I Can See Clearly Now." So that kind of summed up her thoughts about being treated for ADHD. It really, really worked. But anyway, there's a couple supplements I want to talk about. One mainly, and that's called L-tyrosine. And I'm going to mention another little supplement in a little bit called L-tryptophan that can help the tyrosine to work better. L-tyrosine is something I've used for a long time for ADD, and it's both by itself and with stimulants like Adderall. It enhances them as well, but it does a lot of other things too, and I want you to kind of understand how L-tyrosine works. It's an amino acid. You get it from protein foods like meat, fish, and eggs. And it turns out it's required to make dopamine. You know, we talk about dopamine. I did a little talk on Parkinson's a couple weeks ago. But dopamine is an essential happy mood neurotransmitter. And when you get depleted of dopamine, it causes Parkinson's disease. But most people need dopamine to feel good. And I'll tell you something that I tell all my new patients. Life is not fair. I mean, why are some people naturally depressed and other people seem like they're happy all the time? Well, it's a lot of times because it's how much dopamine is active in their brain. But there's things you can do to, if you're chronically depressed or in a bad mood, kind of like Eeyore, you know, in the cartoons, chronically sad. So life is not fair, but if you're chronically depressed or sad all the time, there's a lot of other factors, but you know, your brain may not be making enough dopamine or some of the other neurotransmitters like serotonin, which comes into play here, epinephrine, norepinephrine. You need to think about your neurotransmitters when you're talking about cognition and brain health. But anyway, so L-tyrosine is required to make those neurotransmitters, even serotonin, which you think of as the depression. When you don't have enough of it, you get depressed. And that's why so many medicines are made to raise your serotonin levels. But anyway, so L-tyrosine, it also does some other things. It helps to make your thyroid hormones. It helps your energy levels. It helps your memory, cognition. It even helps your muscle memory. Your body also uses tyrosine to make melatonin. We talk about melatonin for sleep all the time. And also CoQ10. So it's a precursor to a lot of essential compounds in your body. Now, why can't your body get enough of it from food? Because when protein is eaten, the tyrosine can get bound up to other amino acids, meaning it may not make dopamine in that case because it's bound up, and usually that's the case. Also, when you think about it, your body needs the B vitamins and C vitamin, vitamin C. We talk about that a lot. And it also needs enough iron stores to make tyrosine from phenylalanine. I don't want to get too deep in the woods with biochemistry here, but phenylalanine has a lot to do with it also. Like I say, I've used L-tyrosine as a supplement for years for my patients with ADD, and as a supplement to people that are on stimulants. People tend to feel more creative, more energetic, and happier. And I've found over the years too that combining L-tyrosine with L-tryptophan, mostly in the form of 5-HTP. That's the form I like to use it in the most, because 5-HTP, in contrast to just L-tryptophan, breaks the blood-brain barrier, so it works better in the brain. And it really helps for mood and depression. You need balance with all these neurotransmitters. So the combination of L-tyrosine, which usually is given in the morning on an empty stomach, and it turns out that 5-HTP, which is hydroxytryptophan, the active form, also should be given on an empty stomach, but at night, because it really helps you sleep. And you can even take it with some of the other things at night, of course, like melatonin, even GABA. That's a good combination. I don't know if you read in Psychology Today years ago, but the actor Jim Carrey told his story about how the combination of L-tyrosine and tryptophan helped alleviate his crippling depression. The other things that L-tryptophan can help are many, but it kind of calms you down. But tyrosine, which is what we're focusing on, I just like the combination of tyrosine and tryptophan a lot. It makes it work better. But tyrosine helps PMS. It helps reduce alcohol cravings and addiction. And remember, because it boosts dopamine, which is a reward hormone. Tyrosine is also helpful for controlling appetite. So we see weight loss with L-tyrosine. It also can help hair growth, and also, interestingly, can even turn hair that's graying back to its normal pigment. And remember that brain-gut connection. Mental health is connected to gut health. Remember that. And not only because of the vagus nerve, but because of your digestion. If your gut microbiome is off, and those enzymes that convert amino acids into usable compounds for the brain, like tyrosine going to dopamine, you need that gut to be balanced. That's why the first thing I ask any patient that comes into my office, a new patient, is, how's your gut working? So the first thing we concentrate on is that gut balance. So that microbiome. So if you have some imbalances, these supplements may not work. So the same is true for serotonin and GABA. So look at your gut balance first, as we always do. If you take L-tyrosine, you might want to see how this helps you. If you think you may have ADD or brain fog or depression, take it on an empty stomach, and the same for L-tryptophan at night. My favorite form of that is 5-HTP, so it won't bind with the other amino acids and render it ineffective. The typical doses of L-tyrosine are between 500 and 1,000. I always start slow and go from there. I always am very conservative. For 5-HTP, you can take it from 50 milligrams to 100 milligrams. So I like about a 10-to-1 ratio of tyrosine to tryptophan. Remember to take it with your B complex vitamins as well, because you need the B vitamins, you need C, and address any iron deficiency that you may have as well. The side effects of L-tyrosine are few. If you took too much of it, it could give you a headache, nausea, and irritability. And if you have uncontrolled hypertension, you need to watch out for it. It can be energizing. Also, if you're on medicines for Parkinson's or ADHD or antidepressants, you want to check with your healthcare provider first before you start it. But it's very safe. And another thing I always emphasize is take breaks from it. Long-term use of any of this stuff can deplete all of your other neurotransmitters. So like it is with any vitamins or things, you need to take an occasional break from it. See how you do with it, and work with your provider to kind of help you with this. So brain fog, very common. Anyway, it's a lot worse with the COVID fallout that we're seeing. We're seeing a lot of long haulers, and brain fog is one of the most. Brain fog, fatigue, shortness of breath on exertion, dizziness are some of the main things I see with long haulers syndrome. And certainly we have enough brain fog without compounding it with long hauler COVID. So we have to look at all this. So look at L-tyrosine. That's the main thing I wanted to get through to you today is do your research on L-tyrosine, and also maybe consider combining it with tryptophan. And doing all the other stuff that's necessary. Come in and look at all your hormones, your thyroid, and your melatonin, your CoQ10, all those things that can help brain fog and give you more energy and a clearer mind to think. So I hope if you have any of these concerns, you'll come to us and maybe get on our website, performancemedicine.net, and maybe even join our Q&As on Tuesday nights. So I hope this helps. I'll see you next week. This is Dr. Tom Rogers at Performance Medicine.